Mhm. Good afternoon. It is Monday at 4 o'clock. That time we come together to remember that we're going to get through this. We're going to get through this together. And one reason I know we're going to get through this is we have Virginia Moore back. Virginia, we missed you. We are so glad you were back. Very happy to see you, even if it's just on the screen. Thank you. Today, wearing my mask, which is Larry A. Ryle High School in Boone County. They are the Raiders. We appreciate them doing everything that's necessary to protect their students and everybody else in their community. So we're going to have a packed today. We're going to start with the tougher news about where the country is. We're going to go through a couple of updates and our COVID update for the day. And then we're going to talk about vaccines. We're going to talk about the new Moderna news. We're going to talk about our plans with the first initial allocation from Pfizer. Then we're going to talk about a dry run that's being done today, along with the federal government testing out, making sure that we are ready for the very first moment when we are allowed to begin vaccinations. So let's start with the tough news. It's that this country is reeling from the coronavirus. We have 13.4 million cases in the United States since this virus began. 4 million of those were just in the month of November. The month of November is seeing more cases than we ever thought possible. And it shows that the country is in an exponential growth of this virus, just like our Commonwealth is. We've now lost 266,051 Americans. 266,000 of our neighbors and friends. There are more than 250,000 families that are mourning. This is a serious, deadly virus, and those numbers should show you that we are at war. This virus has declared war on us. It has taken so many people from us, and our job and what we're doing here in the Commonwealth is to fight back. The escalation in cases that we just showed is straining our healthcare system and healthcare systems across the United States. We've been showing you news, including the Mayo Clinic having to put beds in their parking garage, of New York recreating its field hospital and others. Well, Rhode Island today started admitting patients, or is admitting patients this week, to their field hospital. It shows when you have uncontrolled growth in cases, you have more hospitalization needs, and you start running out of either beds to put people in or staff that can help take care of them. And as we saw both in the initial surge of the virus in places like New York, or in the summer surge in places like Arizona, once you reach that healthcare capacity point, once you have more people who need help, then our providers can give help to. You see those death numbers skyrocket, and we are just simply not going to let that happen. This is what's happening in Kentucky right now. As you can see, how much cases have been increasing. This last week was our second highest week ever, but I'm going to tell you it would have been our highest week, but for what is almost a 4-day weekend where we see less people being tested. We see the labs closed on multiple days, not just 1 or 2, some of them even 3 days. And what it suggests is that we may have a very large week this week or next. Now, my hope is that these aggressive steps that we are taking to save lives starts impacting this soon. With the incubation period, it can take at least 14 days to start seeing that decline, but we've got to stop this rapid increase. With the increase in cases, we see a corresponding increase in hospitalizations. Again, that curve continuing to go up in our COVID inpatient census. That means that there are more people needing hospitalization in Kentucky than ever before. That means that they need a bed. They need the doctors and the nurses to help take care of them. They may need medication. Again, we've got to make sure we can level off and eventually decrease this demand. They were talking in the United States right now. There are more people hospitalized for COVID than ever before, and I believe the statistic is 20% of people hospitalized nationwide right now are hospitalized for the coronavirus. We look at the ICU, again, continuing to increase day over day, the number of people in an intensive care unit. And that means that these people are fighting for their lives. Exponential growth in cases, increasing strain by increased hospitalization, increased need for ICUs. And we see other states rapidly running out of ICU beds. And once that happens, it means you can't give the intensive care that some patients need. And again, you lose more people, you have more fatalities than we have to. And so ventilators, the same. This one's tough. I got an email just the other day from an acquaintance who has both parents on ventilators right now. And it's hard to even fathom how you must feel with a family member that is in that bad a shape. As we see these numbers increasing, again, we have a duty to do what it takes to turn this around, to make sure that there aren't this many families in Kentucky and in the United States that are watching their friends, family members not be able to breathe on their own. And once we see is that when someone's on a ventilator, unfortunately, and often they don't make it. So let's again make sure we address the number of cases and do what it takes to protect one another. Now, if we look, these steps that we are taking, they're more aggressive than some of our neighbors, but we've been taking more aggressive steps since the beginning of this virus, committed to fighting back, to not surrendering to it, to not accepting avoidable loss. So this next chart just gives you a little bit of comparison between us and Indiana, a neighbor at the north, and Tennessee, a neighbor to the south. These are deaths adjusted by population. So it already adjusts for the fact that both of these states have more individuals than we do. And just look at those lines. Kentucky is the blue line. It means we've had significantly less death, even adjusted by population, than many of our neighbors. This is the strong action we're taking, and I know it comes with sacrifice, but just think the distance between those lines, between the blue line and the orange line and the green line, is how many more lives we are saving right here in the Commonwealth of Kentucky. That our sacrifice and the difficulties we go through is truly making a difference. You can see it very clearly in the data. But we still could, this still is a very fragile place. And it's why these steps we are taking are absolutely necessary. But again, we can show you in the past how they have worked, how they have saved lives, and we've got to continue to do this. This is a story looking back where Kentucky can be a national leader, and we hope is remembered as a national leader because we care about each other, we do what it takes, and we do not give up, no matter how long it takes, and no matter how hard it is. We do not give up when it comes to fighting for the lives of our neighbors, for the health of our friends, for the education of our kids. This is what we do as Kentuckians. So one of the things that we need to do as Kentuckians, in addition to the steps we've outlined, is to provide you the advice given by Dr. Deborah Birx. This is the White House Task Force about what you should do if you travel or got together with large groups of people on Thanksgiving. We need you to assume and act like you have the virus. We need you to go get tested. We need you to stay away from other people, and especially vulnerable folks, until you get those tests back. And we need you to be just very, very careful at this point. They are expecting across the country a significant and dramatic post-Thanksgiving surge. Our hope is based on the timing of the strong steps that we are taking, that we will see less of a surge. But that is dependent on everybody out there who did get together in large groups or who traveled in now doing their part to make sure they don't spread the virus. So again, please follow this advice. It's from the federal government that if you got together in those groups, act like you have it. And until you get tests back showing you're negative enough days after Thanksgiving, don't go around other people at all if you can, but certainly don't go around those that are at risk. And please wear a mask. Please wear a mask, no matter what. But if you haven't been wearing one yet, and again, you celebrated Thanksgiving with a large group or traveled, we need you to certainly right now. So that's where we are in the country. Dangerous, escalating place that they keep predicting is going to get worse before it gets better. But here in Kentucky, we got a chance to disprove that, to do the right thing, and to protect one another. It may end up being grim across the country, but it doesn't have to be here. We can be stronger. We can be better. We can be more aggressive. We can do what it takes to protect one another. We can be kinder. We can be more thoughtful. In trying to help out those that are sacrificing the most, we announced when we were putting these restrictions in place that we were creating a fund, a $40 million fund for bars and restaurants impacted by this latest step. If we can put up the slide about how to apply, I want to give an update on that. So last week, I announced that we'd be launching the Team Kentucky Food and Beverage Relief Fund to provide financial assistance to restaurants and bars that were required to close for on-site or indoor service. We are glad to announce that the application process for that fund is now open. It went live today at 10:30 a.m. Right before we came on, we had nearly 2,200 applications submitted, and they request several million dollars. We'll get that total, but nowhere near right now the amount that we have reserved. So what that means is others need to get on and to apply for this. We want to help out everybody who qualifies, and there's certainly the funding there. The fund has been designed to provide one-time grant awards of up to $10,000 per restaurant or bar, with a maximum of $20,000 to a business entity that operates multiple restaurants and bars. The grants are to be used as reimbursement for business expenses incurred between March 6th and December 31st. Reimbursable expenses include rent, employee salaries, health insurance costs, inventory, and personal protective equipment. We have an overall pot of $40 million in federal CARES grant money to fund the endeavor. So we have a lot of aid that is out there and available. I know it doesn't come nearly close to making those establishments whole, but if you qualify, make sure you take advantage of this program. The faster you apply, the faster that we can get you that help. We have an update on the travel advisory. Jim, if you put that up. As you can see, this list grows and grows. And you look at the exponential growth across the country and just look, I mean, we have 3 states with over a 40% positivity rate. Number in the 30s and in the 20s. Ohio is on here for the second time at just over 15%. Again, the advice that we are giving is, first of all, don't travel. But if you do, and you travel to one of these states, we would ask that you quarantine when you get back. 15% is a huge positivity rate. And what it means is if you've traveled to these states, you are more at risk than if you were in Kentucky, and we'll ask you to take the necessary steps to protect other Kentuckians when you get back. All right, today's report is the second highest for a Monday, just barely below last week, of 2,124 cases. Remember, Mondays are some of our lowest days because not all the labs are open over the weekends. And we believe that that is further exacerbated in this instance because of the Thanksgiving weekend. So we will see as we move through the rest of the week what the numbers are. My hope, of course, is that they decrease from last week, but our expectation is that they will still be high and probably higher than last week, this week. And then we hope to start seeing leveling off next week. If not in this one, we can all hope and we can all pray. 203 kids 18 and under are positive in today's report. Our total number of cases now 179,041. Our positivity rate is now up to 9.42%, a very concerning number that shows you that this isn't a function of increased testing. It's more people who have the virus, even amongst those that are getting tested. Currently hospitalized for COVID, 1,741. That's up 32 people from just yesterday. Currently in the ICU, 421, up 14 from yesterday. Currently on a ventilator, 229. That's up 11 from yesterday. New cases by county: Jefferson, 354, Fayette, 219, Kenton, 97, Davis, 90, Warren, 82, Boone, 73, Oldham, 52, Pulaski, 46, McCracken, 45, Campbell, 43, Jessamine, 40, Boyle and Mason, 37, Bullitt, 36, Grant, 33, Henderson, 31, Scott and Shelby, 30. The rest can be found at kycovid19.ky.gov. A lot of other counties in the double digits. Sadly, today we have 12 new deaths that COVID-19 was a part of. At least one of these individuals we believe is a school teacher. We'll wait to get permission from a family to talk about that. They include a 74-year-old woman from Caldwell County, an 86-year-old woman from Caldwell County, a 50-year-old woman from Davis County, a 90-year-old man from Fayette County, a 68-year-old man from Grayson County, a 56-year-old woman from Jefferson County, a 77-year-old man from Marshall County, 3 individuals from McCracken County, a 75-year-old woman, a 75-year-old man, and a 67-year-old man, and an 87-year-old woman in McLean, and an 84-year-old man in Webster. Those are 12 families that are going to need your help. So make sure you reach out. I've been reaching out to individuals that, and more individuals that are losing family members or friends. Provide whatever help you can. It just helps that you reach out even. And let's keep those green lights on. Let's ring those bells at 10 a.m. Kentucky's number of deaths is now up to 1,908. So there are a lot of people to lose. Those are a lot of families that are hurting really badly. And in that tough news vein, I'm sad to report that we've lost 2 more of our veterans to COVID-19 at the Thompson Hood Veterans Center in Wilmore. Now lost 30 veterans from that facility. There's only 2 active cases of COVID in veterans now at the center. And there is 1 new veteran testing positive for COVID at the Western Kentucky Veterans Center. This is its first COVID positive result in a veteran in that facility. How much this is spreading right now is seen here. We kept COVID out of Thompson Hood, thanks to the hard work of the staff there, through the middle of October. But community spread is so overwhelming that it's breaking through all defenses. And because of that, we've lost 30 veterans. Let's fight harder for them. Let's wear our masks for them, whether we like wearing a mask or not. These veterans, they went through a lot harder times and they sacrificed a lot more for us. So if you claim to be a patriot, recognize and fight for these patriots. Long-term care facilities, and this is going to move into when we talk about the vaccine and some of our plans. Some of the main reasons why. 445 new residents since Friday have tested positive, 292 new staff members, and 70 additional deaths attributable to those in long-term care facilities. I think 66%, or right around there, of everybody we've lost to COVID has been in a long-term care facility. And right now with community spread, even with the best efforts, we can't keep it out of those facilities. So those that are in there that are most vulnerable, that are most likely to lose their battle with COVID, are counting on us, each and every one of us, to do what it takes to protect them. And all it takes is making good decisions every day, because every day you can be a hero, or every day you can put somebody at risk. These are the choices that each of us makes each day that we wake up in a global health pandemic. Kentucky child care facilities, 22 new facilities with at least one positive case, 22 new staff members, 17 new children testing positive. All right, that's the tough news. Now let's talk about good news, and that's the COVID vaccines. At least the two that we know a lot about right now, as long as the data holds, are miracles. If Pfizer and Moderna stay in the data above 90% effectiveness, then it's incredible news, and we can put this entire pandemic in the past. So the good news today, because we heard about Pfizer before, is Moderna got more of their data than the initial. It's still at least 94% effective, but here was the other piece. At least in this trial, it was 100% effective on severe cases. And that's what we want, 100% effective on severe cases. I watched a national expert talk about the fact that if this holds, we can turn COVID into something like a cold or a minor flu. Think about that. After all that we have been through, and after all that we have lost, and all of the people that we are going to miss, we have a chance to beat this thing and to render it into something can't harm anybody else ever again. We can take on this adversary and forever defeat it if we do this right and get back to everything that we have missed during these very difficult numbers of months. So that's a great news for today. It was great news to wake up to, and it's very exciting. So all that effectiveness and the rest leads us to the win. We believe that we are going to get our first allocation of Pfizer vaccines as early as mid-December. This will all depend on when it gets initial approval and then the shipping occurs. We believe that we could get the first allocation of the Moderna vaccine as early as 2 weeks after when we get the Pfizer vaccines. Now, initially, these shipments are going to be very limited, but they are still very exciting. And the numbers we're getting are a lot smaller than what initially the federal government thought they could provide, but it's still important. So today we can announce that we will receive in our first shipment of Pfizer vaccine 38,025 doses. That's 38025 doses. So, and those will be provided to 38,025 different individuals. We can go ahead and provide everybody the first of these shots, and then we will receive the boosters, because the Pfizer vaccine and Moderna, like that hepatitis vaccine that we had to take the two separate shots separated by about 3 weeks. Dr. Steck can correct me when he comes on right after me. So we are locking in our plan this week to provide to the federal government, and we will be ready on moment one that we're able to start providing these vaccines. So for this limited amount, our plan is going to involve two groups that will receive certain portions of the first allocation of the Pfizer vaccine. First group is long-term care residents and staff. Long-term care residents make up almost 66% of the deaths due to COVID. Think about that. If we can get through and vaccinate our residents and our staff, we could cut off 66% of the deaths that we are seeing right now. So our numbers can dramatically change, and we can provide such better protection to these individuals. And long-term care residents, when they have to go to the hospital, take up more resources than the average patient. So when we look at numbers of doctors and nurses that are available and how many patients they can see, if we can protect our long-term care residents, they don't end up being hospitalized, we have more capacity there in those facilities. So we believe that there are about 50,300 residents and staff in the highest and kind of the most intensive tier of long-term care. So in this first allocation, we'll be providing 26,000 doses to those long-term care residents and staff. Provided that they can handle the Pfizer vaccine, Walgreens and CVS would handle this program as they've contracted to with the federal government. Our goal is to quickly vaccinate the most vulnerable parts of our population. Second group that will receive part of this initial allocation are our frontline COVID healthcare workers. This program, as opposed to the Walgreens CVS, is a state-run program that goes through healthcare facilities that meet certain requirements and have been able to sign up through the state with the federal government to provide vaccinations. These facilities will receive 12,000 doses. We are finalizing a list of what facilities will receive them, but they will be all over the state. Geographically, we're committed to sites in northern Kentucky, eastern Kentucky, western Kentucky, south central Kentucky, along with Louisville and Lexington. And our final location list will be provided to the federal government at least by Friday. So I discussed this plan with several hospital CEOs today, and I just want to reiterate that they agree that this plan and the way that we are setting these two priorities help them in their ability to serve patients by reducing long-term care residents that would need hospitalization, that need more time from a doctor or a nurse, and therefore free up more time for those individuals to help other people, as well as the fact that they unfortunately are the least likely to make it out of the hospital when they have to go there. Now, we are projected to get 76,700 Moderna vaccinations in our first shipment, which again, we hope is in late December. But we are going to be ready. We believe the federal government is going to agree to this plan. I think it's going to be their recommendation as well. But part of being ready is also the practice run that we have been doing today. So we've already been working with the U.S. Centers for Disease Control and Prevention on our plans to distribute a corona vaccine or vaccines in the Commonwealth. So right now, this week, we're participating in an end-to-end exercise with the CDC along with Pfizer and McKesson. This will test one shipment of an empty thermal shipping container from Pfizer and a mock ancillary kit from McKesson to one clinic site, in this case, the University of Kentucky Medical Center. As part of this exercise, the Kentucky Immunization Branch has until noon today to place an order for UK Hospital in what's called VTRAX, which is the CDC's ordering program. Tomorrow, CDC's VTRAX will send the test order to Pfizer and McKesson. The empty thermal shipper and mock kit will be shipped by the respective companies. By Tuesday, the shipment tracking numbers should be visible in the system. The empty container and mock kit are expected to arrive at UK Hospital as early as Wednesday or as late as Friday. This is a test. This is only a test, but it's a test to make sure that the logistical part of us getting vaccines from the federal government upon ordering them is going to work and work smoothly. So Kentuckians should feel confident that we are working day in and day out to make sure that we can get this out as quickly as possible. And along the way, we'll talk to you about some of the difficulties. Information, even from the federal government, seems to change by the day, but this is the problem that I so desperately wanted to have. Even if that problem is a lot less vaccine early than expected, it's still coming. It is still coming. The light at the end of the tunnel is getting brighter and brighter. It's also why I need you to keep fighting. Because if there are folks in long-term care that we get vaccinated starting this month, maybe we could vaccinate most all of long-term care by the end of January if shipments come in. But we don't do our part between now and then. There are a number of people in those facilities that'll never get to see that vaccine or get the benefit of it. More than ever, what we do right now can save lives, especially of the most vulnerable. With that, we'll go to Dr. Stack, who's got some more information on this good news about vaccines they're coming. They're on their way. Dr. Stack.
Thank you, Governor. Good afternoon, everyone. Do you have my slides, Jim, please? I want to just go over a few things real quick to provide a little additional background. So there are two vaccines that are currently being considered. Many of you already know this. The first one is the Pfizer product, and the second one, the Moderna. Both of these use new technology, messenger RNA vaccines. Remarkably, if the initial data holds when we see it at the FDA hearing on December 10th, if these are 95% effective, that is absolutely remarkable, and a real testimony to modern medical science and our ability to do things that humanity never before could do, and certainly not at this pace. So they appear to be safe. They don't have any significant adverse safety concerns. Initial reports say that a few percent of people get fever and body aches and symptoms, which are not uncommon for some people with certain vaccines. And so that is a good sign. The other thing is they seem to show that all the severe disease seems to be prevented by these vaccines so far. Now, again, we have to see the data and we have to see how it all breaks down, but all of this is very positive. The one challenge, though, of course, is that Pfizer vaccine has to be stored at minus 80 degrees Celsius. That's minus 114 degrees Fahrenheit, and that's challenging. The Moderna, initially we thought had to be stored at minus 20 degrees Celsius, which is still pretty cold, but we now have found in the recent weeks that it can remain stable for up to a month at refrigerator temperatures. So that makes that vaccine much easier to use. So these are really promising vaccines, and we'll get over the hurdles of the logistical challenges. Next slide, Jim. All right, so I want to tell you just real briefly, there is an extensive process in play here. First of all, they had to build these vaccines, they had to do the research, they had to demonstrate that they were safe. Concurrent with that, we've had to consider how will we use these vaccines when very small quantities are available at the beginning, but there are many, many people who need the vaccine. So the CDC has a committee that already exists called the Advisory Committee on Immunization Practices, that's ACIP. And ACIP has been working very closely with the Food and Drug Administration and its committees. And in fact, they're going to have an emergency meeting tomorrow to take a look at the evidence that they have available at this time and further refine their recommendations based on what information they know, and probably tentatively make recommendations subject to the FDA's final hearing. So to put a timeline on this, the Food and Drug Administration will consider the Pfizer vaccine on December 10th. And then sometime after that, once Moderna submits its materials for their emergency use authorization, they'll have a hearing for Moderna. The ACIP committee will meet to independently recommend, one, do they advise the vaccine be used to vaccinate human beings? So they'll review the data determine if they agree with the FDA and its safety recommendations. And if they do agree, then they will recommend it be used. Then they'll say, for those vaccines that are felt to be safe and effective, which people do they recommend get the vaccine? Sometimes some vaccines work better in different populations than others. So they're going to make a recommendation which vaccines they think are best suited to certain populations. But most challenging in this case is there will be a relatively small quantity in the early weeks and months. So they're going to have to recommend which populations get it when it's very scarce. And this leads us to my final slide. If we could go to the next one. Next slide, James. I'm sorry. So this is a little backwards when you look at this because the highest priority is at the bottom of the pyramid here. But it would appear that there is consensus, and again, the committee reserves the right to make changes tomorrow if they feel differently, that healthcare professionals and long-term care facility, and it says residents on their slide here, but the healthcare professionals get included in the HCP part above it. So long-term care facility, that's nursing home residents and staff, and also healthcare professionals would be in phase 1A, the very beginning groups. Now, I want to put this in context. The first shipment of Pfizer vaccine at the moment is projected to be about 38,000 doses, like the governor said. That's 1/3 of the quantity we initially thought we would get. And again, in fairness to the federal government, these are a lot of moving pieces, and so it's probably been difficult to exactly model these quantities. But what we think we're going to get is now 1/3 of what we initially thought we would get. So this is going to compel more difficult choices. And all the hospitals have been asked to determine tiering for their healthcare professionals so that those at most risk of exposure to the disease and to patients with the disease would be in a tier 1 category. And then we'd go through different tiers of healthcare workers from there. This is important because we have over 200,000 healthcare professionals in the state of Kentucky. And if we're only going to get less than 100,000 doses in the first month or month and a half, we're going to have to make sure we get the people who need it the most and will benefit the most, and then work forward from there. For the nursing home residents, I do want to make a few observations. In the state of Kentucky, this is where 2/3 of our deaths have occurred. So 66% of our deaths in Kentucky have been in nursing home residents. Additionally, nursing home residents go to hospitals usually before they pass away and are high intensity healthcare users. And so this is when hospitals get overrun. Third, nursing homes have to go through a lot of personal protective equipment when they have outbreaks, and they have to consume a lot of testing resources when they have outbreaks. If we were to vaccinate that population first, it has numerous multiplying benefits of preserving avoidable death, so keeping people alive who would otherwise die from this. 2, unburdening the hospitals and minimizing the risk of healthcare system overload. So that means everybody, not just COVID patients, but COVID patients and non-COVID patients have access to a functioning healthcare system, reducing exposure of healthcare workers to the disease, so indirectly protecting more healthcare workers, and then sparing PPE and test consumption, which are both very costly in the current environment. So there are a lot of added benefits. Now, we have some committees that will review the materials. So there's an emergency meeting of the Advisory Committee on Immunization Practices tomorrow. They'll review those materials in very short order, see if we agree with their recommendations, and then we'll recommend to another advisory committee that is a larger cohort of individuals what ACIP says and what we in Kentucky tailor, and then present that to the governor. Now, all the indications, though, from all the messaging nationally are that the national experts have really clear consensus about tier 1 healthcare workers and long-term care facility residents and staff as being the phase 1A, and there does not seem much likelihood that will change. There will be additional difficult decisions as we go forward, because on that 3rd slide, when you look at phase 1B, it talks about essential workers, which includes educators and first responders and individuals in food service preparation and certain types of manufacturing and infrastructure. And so those committees we have are going to have to look at that and help us additionally with recommending next tiers, because it will take many months to ramp up production before we can get to a situation, hopefully by next summer, where most people have access to a dose of vaccine if they want it. But it'll take all of next year. And I want to leave you with one last closing thought here. So the first thing is, this is all wonderful news. Vaccines with 95% effectiveness and a good safety profile could help to get us out of this horrible abyss we find ourselves in, with the economy impaired, with people's livelihoods impaired, with people's social needs with each other impaired, all these different things that have, with education interrupted, all these different things the vaccine could help with. But we're not out of the woods yet. And so in one of my calls with my fellow state health officials today, there's a lot of worry. The combination of cold weather, holiday gatherings, increased travel, a fatigued public who is not fully complying with the mask mandates and with the social distancing, that the combination of these things leads to a really dark and gloomy place over the next couple months. That the very things we just said that we could help to prevent and avert with a good vaccine could all happen in the next 8 to 10 weeks. And just to put this in context, any of you have ever gone to West Virginia and rafted on the Gully River, we've only had in Kentucky, in healthcare terms, class 2 and 3 rapids so far. All the class 4 and 5 rapids we've managed to avert and spare here because we've not had our hospitals in any large numbers overrun, and we've never had one collapse because of being overrun with so many COVID patients. So we face the real danger, the real risk, if we don't all mask up and socially distance and follow those simple things, those things that could help reopen so much of our activities, if we would just all stay 6 feet away from each other and socially distance and not mix and match with each other while across households while the disease is so high. If we would all please just do those things, that will help buy us the time we need and avoid the crushing, overwhelming volume of sick people who could show up at the hospitals in December, and really transform the holidays from a time of celebration to an even darker time than they already feel, with 2020 being such a rough year. So please, Team Kentucky, we've been through a lot together. We're not out of the woods yet. There is a bright light at the end of the tunnel, and it's a good light. It's one that offers hope and a reason for us to be confident that there are better days ahead, and that as 2021 unfolds, we have every reason to be very optimistic. We'll end up in a better place than we entered it. So, Governor, thank you very much. I appreciate the opportunity to share this information.
Thank you to Dr. Stack. And I'll be sending him information on places in Kentucky where he can go whitewater rafting and not give his money to another state. We'll open it up for questions. I've got just a couple of written ones, and we've got, I think, at least 10 journalists on the line. So we'll start with Joe Ragusa from Spectrum. We'll wait just one more minute for Joe. We'll just be patient, and until then, I will ask a question. How great is it to have Virginia Moore back? And the answer is incredibly great. We are so happy you were healthy. All of Kentucky has missed you and needs you, and we are glad you were back. I will give it just another minute. I'll go to the written questions. What were your big takeaways from your 2 p.m. call with Vice President Pence? We did have a governor's only call today. It was all on vaccine distribution. It was a positive call. It was just making sure that states were ready. We knew the steps that we had to take. The communication has been good. The numbers change. Sometimes the process changes, but they continue to communicate with us. And we are excited, even though the allocation is smaller, than we had hoped for to get as many vaccines as we can as quickly as possible. What do you intend to do about a potential stimulus for Kentucky businesses if the federal government doesn't step up with another round of funding? I believe that when we announce our budget, that we will be looking at ways we can help both individuals and businesses if the federal government is not going to step up and do the job that we so desperately need it to. The federal stimulus that we saw over the summer and early on, I believe, worked. It helped ensure that our economy wouldn't go in a worse place than it is. We saw significant spending come out of it. We saw revenues from the state very positively impacted. Ways that they provided CARES Act funding that we were able to provide to local governments to do the utility fund to help people out, the eviction fund to keep people in their homes. All of those were very positive steps that I think really worked. But now, with the federal government failing to act, we're seeing people that are going to lose the unemployment that they are currently getting at a time when they need to continue getting it. We're going to see all funding dry up for testing and doing everything else we need to defeat this virus. Congress has to act, has to. All right, now let's try Joe Ragusa from Spectrum.
I'm here now. So as far as the data that we're talking about, the number of tests that we're seeing over the last several days being impacted by the holiday, how do you move forward analyzing the effectiveness of your new restrictions, or even judging the need for maybe more restrictions or an extension of the current restrictions based on, how these numbers are going to look for the next few days or even the next week or two?
Well, it's going to take a little bit more time. We can't judge this on just one day, but through a week, it ought to work itself out in the data. And we can also look at things like the positivity rate. I have a question here. Is there any sense that a high level of testing by people wanting to gather at Thanksgiving was responsible for the record number of cases? I think it had an impact, but you can gauge that by we had a couple days where the positivity rate went down. Now it's back up. But remember, we were over 9 and it came down below 9 for a couple days, and now it's back up to 9.24%. So when we have more people wanting to get tested, it can impact the numbers in different ways, but also give us a clearer picture of what's actually out there. So again, when we're looking at what we need to see to show that we're having an impact on the virus, we'll be able to compare what's happening nationally and here, especially after Thanksgiving. We'll be able to look at the speed of the increase, especially this next week as compared to last week and the week before. If this week isn't as significant as 2 weeks ago, then we may be plateauing again. That would be a very positive development, because we got to slow down the train before we can stop it and before we can turn it around. So we're going to have a lot of data available to us. And it's certainly our hope that these sacrifices that everybody's making slow down the virus and buy us more time to get the vaccine out, especially to those most vulnerable. Catherine Collins from WLEX.
Hi, Governor. I'm wondering if with these first rounds of vaccine, if they will be free to frontline healthcare workers and people in long-term care facilities.
Yes, my understanding is that the vaccines are free. And our hope is that they will continue to be free. The challenge to that may be if the federal government doesn't act at all and doesn't provide any extra dollars for the logistics that are necessary to get this out. Shelby Smithson from WKYT.
Hi, Governor. Since we are receiving fewer doses than originally expected, do we have any sort of timeline on additional shipments of the vaccine?
So we have at least an idea of when we will get that first set of Moderna in, which I think I said was 70-something thousand. We think that'll come as long as the timeline stands with with the FDA and others where we think it is. We think that'll come about 2 weeks after. But our hope is that at least every 2 weeks, we are seeing additional shipments from the federal government. Now we're gonna start getting more information and more certainty to that, in real time moving forward. We'll be able to check in a system that we have access to on our allocations as they come out. Right now, we're being allocated based on population of the United States, so nobody out there is being favored or disfavored, and that's certainly an approach that we want, certainly here in Kentucky. But as soon as we have information on new allocations, we will provide it. But just like the amount we thought we'd originally got changed dramatically, these numbers can change, and the information can change that we get from the federal government. So we'll just try to be transparent about what we're told is being allocated, and then what actually arrives. But they've set up a system to where I think that we will, at least a couple weeks ahead of each shipment, have a good idea how many are coming, when, and where. This will all be impacted too if we get either of the other two vaccines authorized, if they come back and have good results. The AstraZeneca right now, there's some challenges in the data. So I think that one will at least slow down. The Johnson & Johnson, if it shows a high effectiveness and it's approved, it's just one shot as opposed to a shot and a booster. And certainly if there are 3 out there with everybody manufacturing, then that'll speed up the timeline and the amounts that we're getting as well. Tom Latek from Kentucky Today.
Thank you, Governor. I hope you had a nice birthday yesterday. There's a coalition of government and business groups that are urging Congress to, of course, renew CARES Act funding, or whatever else they might want to call it. And I was wondering if you have contacted the members of our Kentucky congressional delegation to, try to egg them along into approving this.
Yeah, we've got a letter sitting on my desk about just that. We've talked primarily to Leader McConnell's office at different points. We have even provided the bare bones of this is just what it takes for the testing and the tracing to him. But we need a lot more than just the bare bones. I understand. I understand what the steps we've had to take have done, how difficult it's made it for some people to get by, and they deserve to be made whole as much as possible. The food and beverage industry, without congressional help, even despite these latest steps, even if we hadn't had to take them, it was going to need help. It's going to need real significant help. And if we don't take those steps, if we don't provide that help now, then it's going to take a lot longer for our economy to rebound. You look at the Federal Reserve saying we can't stimulate the economy enough right now, and those are economic experts. So we really need that package to go through. Now I try not to get in the back and forth. Sometimes you'll hear you need to push Leader McConnell for this, or you need to push Speaker Pelosi for that. My goal is to push for Kentuckians. I want to stay out of that back and forth, but I want Congress to act. I don't care where they want to place blame. I don't care about the politics that anybody is playing or not. The American people need their help. It's time to act. Stu Johnson from WEKU.
Good afternoon, Governor. As you and Dr. Stack have talked about this afternoon with the vaccine going to long-term care facilities and frontline caregivers, when it comes time to get the vaccine to residents out in the state across Kentucky, would you envision the vaccines going to these communities, or residents there coming to urban areas to get injections?
I expect it to be available in those communities. When we announce the final locations for healthcare workers from that allocation, you're going to see that it is geographically diverse. And what we're doing now is we're signing up different people who have the capabilities to vaccinate. And for Pfizer, that requires the cold storage that not everybody has. But we're getting them all into the system right now. And the federal government can ship directly to them in different levels. So we look over we agree with the allocation and where it's going. And the goal is eventually to have enough providers everywhere in the state where the only decisions that we have to make is how many each time in what direction. Lord, I hope that it can be like testing and we can have that many locations in the end. It'll really depend on how many of what vaccine we have. Moderna makes it a lot easier to do that. You think of every pharmacy, every little clinic in a grocery store, every doctor's office typically has what it would need to store and provide that vaccine. So we expect, especially by the time it's available to the general public, anybody who wants one can get one. It's going to be in your community. And we believe it's going to be pretty close to everybody's community at the beginning. It's not going to be everywhere, and it's not going to be available to the general public until we get, the healthcare workers, the long-term care residents and staffers. There's going to be a big priority on teachers, because once we have our teachers vaccinated, school is really safe. It's going to be safe for them. So understanding that for the most vulnerable, for those that are caring for our COVID patients, for our educators, and the value of in-person classes, that there's going to be these some groups that get the vaccine earlier than others. But I think everybody will understand why. Josh James from WUKY.
Thanks, Governor. This may be a question for Dr. Stack. Is Kentucky doing any additional safety checks or creating any independent panels to review vaccines as some states are doing?
Let's send that one to Dr. Stack.
No, we're not going to have any separate panels to review to make a separate safety determination. We will review all the materials that we are provided and make sure we're comfortable with the evidence that's provided and the conclusions drawn from it. We're not creating a separate or special body. The FDA and the CDC are bodies that have done this for a very long time and are very well positioned to make those recommendations.
And I will say that I trust the process that's going on right now. I know there's a lot of politics going on out there. At the appropriate time, I will take either of these vaccines. I believe that while there are a lot of things we could applaud or criticize in anybody's handling of the virus, these vaccines and the way they've been developed is something that I have confidence in. I'm going to be willing to take it. My wife, Brittany, is going to take it, and when it is approved for children, my children will take it too. And listen, I love those three more than life itself, and I wouldn't say that and I wouldn't do that if I didn't believe that it was safe. Debbie Yetter from the Courier-Journal.
Hey, Governor, on the Moderna vaccine, you mentioned maybe as much as 76,000 doses of that. Can you say how that will be allocated? And are teachers a new priority category in phase 1?
So I'll start with the second piece. Teachers have always been right under, sometimes you got phase 1, 2, 3, and then there's 1A, 1B, and 1C, however you want to do that. But right behind healthcare workers, long-term care residents, in just about every priority list, you see teachers along with adults that have very significant conditions that make COVID-19 very deadly for them. Also in that group, you have a lot of other essential workers, but certainly I believe rightfully so are being elevated on the list, knowing that we all benefit from our kids being back in school. And this is a significant step that we can take to protect those educators. And once those educators have been vaccinated, then it's a totally different game. And then the first part of the question was, how is that second set going to be allocated from Moderna? It's going to go to the same groups. I mean, our goal is to get through those, and then first responders, which are also in the very top tier, and that'll all those doses will go to those groups and still not have fully vaccinated them. And so we probably ought to expect at least through the first half of January, unless the production is a lot faster than I expect, that those will be the groups receiving the vaccines. But just think about it. We get through long-term care and we get through those that work there, we can cut out a significant portion of the fatalities we're seeing. It's exciting, the difference that this could make in the lives it could save. Daniel DeRochers from the Lexington Herald-Leader.
Hi, Governor. So, I mean, you just kind of touched on this, but one of the really big things here is there may be some reluctance among people to take the vaccine, right? Just saying that you're going to give it to long-term care facilities doesn't ensure that everyone at those long-term care facilities will take it. What steps is the state taking to ensure that there is trust in the vaccine, first of all, and also to ensure that enough people take it that it is actually effective?
We're going to be communicating as we go about the safety of the vaccine. I'm certainly going to show people that I trust it by taking it myself. What we are seeing, and there's some nationwide numbers on these, is that the confidence is increasing. But we believe in these two groups, the long-term care residents, staff, along with the very front line of the healthcare workers fighting COVID and treating COVID patients, that the confidence with that group is significantly higher. And people are going to be able to watch as others around them are vaccinated. And they're going to be able to not just hear about the safety, but I think they're going to be able to see it firsthand. But we are going to have to continue to explain how the vaccine works, how you can get it. But I do think that the level of effectiveness has been a game changer too. There are some who might have been a little skeptical that if this had been like the flu vaccine at 60% effective, they might have said, well, I don't know about that. I'll take my chances. But to have the opportunity here where it's closer to the measles vaccine, to put this entire thing behind us, I think that's a game changer. But we're going to have to continue to talk to folks, as will their doctors. You know, they just won't hear it from me. They'll hear it from the medical provider who they trust, who they regularly see. And to an individual, I think that those healthcare providers are going to be telling people that this vaccine is safe. But they're going to get to see the data, just like all of us will, to ensure that it's safe. I'm Melissa Patrick from Kentucky Health News.
Hi, Governor. Just off of Daniel's question, I guess I was under the impression that there would be a communications campaign to promote the vaccine to help those that are worried about it. But I'm also kind of curious, you know, if there's no more federal money, is there any to do a campaign?
So there is a planned campaign, communications, that you will see coming out of state government. We are finalizing that right now. We already have the company in place that is assisting us just to provide the basic information to people. And we want everybody to be able to see that information. Now, if CARES Act runs out, if they don't re-up it, at least one positive is that while I'm not sure that the communications would qualify, we do believe that other costs of the vaccine can go through the Stafford Act, which means we'd have to provide about 25% of the funding there. But without another round of CARES Act, it's everything that we do to fight this virus that is significantly impacted to our detriment. Significantly, I can't overstate how bad it would be if Congress doesn't act and they basically say you're on your own. You pay for and fight this virus completely on your own. Ryan Van Velzer for WFPL with our final question, because we are past 5 o'clock.
Thank you very much, Governor. I thank you again for your transparency and commitment to transparency on vaccine allocations. You said the original commitment of doses was much higher, but I didn't hear you say the number. How many doses were initially committed to Kentucky, and who made that commitment?
So the federal government communicated that to us. We can figure out the branch. Most of the time when we have communication, for me, there are multiple cabinet secretaries or others involved in the process that are on. Dr. Stack, I think, had it right. It was about 3 times higher, but we can get you that number. It was in part based on the overall number of Pfizer vaccination doses that they believed that they would be sending out was significantly higher. But we thought that we would have significantly more than that. I thought it was even more than 3 times higher. But we will send you that exact number, Ryan. All right, I want to thank everybody for this fight. The light at the end of the tunnel is brighter than it's ever been, but we're not there. And we still have a long way to go. And we can still lose a lot of people around us if we don't do the right thing. Maybe how we're going to be judged in our response to this virus is over this last period of time. Knowing that a vaccine is out there, knowing we only have to get to it, knowing that we might even be able to turn this thing into something like the common cold or a mild flu, knowing all of that. Are we willing to do what it takes to protect one another, or are we just too tired from the months before? This is our fight. We have to win it, and people are counting on us. So once again, let me say, welcome back, Virginia Moore. We are stronger with you. We're going to get through this. We're going to get through this together, and we will see you tomorrow at 4 o'clock.